Now let's move to, if we were to solve this, what will it take for us to do it in a scale? Ram sir, you gave excellent examples and stats of some of the things where everything you have done had an element of scale and simplicity and cost effectiveness. Specifically for reading losses, sir, if we were to design similar nationwide initiatives, what should be the design principles we should have so that the economics at the rural area and on the long works and becomes it?
Well, thank you very much. Of course, it is this discussion really will not be an appropriate forum to finally design an architecture for such a scalable model. But the broad principles, I can tell you, the broad principles are, as Jaijit rightly pointed out, that there is a market failure. People have not realized the economic value of this doing this part. Even organizations which, let's say, work, suppose somebody is working in a tea garden, and if the owner of the tea garden realizes that this is something which will actually improve the productivity of the tea picker, that owner would certainly be very happy to invest minor amount into this part. So that's one. Secondly, I think one of the reasons why the big corporates or the lens cards of the world may not come is essentially India is a country, if you look at it in a larger perspective, it's a country of low value and high volumes. Today, the UPI transactions have crossed 20 billion transactions a month. And this is a figure of 4 or 5 months old, actually. It's not even now. Maybe now it's 25 billion for all you know. But imagine the average value of the transaction will be very small. So actually, these are the projects which are where the individual transactions value will be only 200 rupees or 100 rupees, depending on the cost of the glass. But the numbers are very, very large. So you have to design the system keeping in mind that ultimately, number of transactions multiplied by the value of transaction will actually be quite significant. In Madhya Pradesh alone, as Jaijit was saying, it is 450 crores. When I was in, just, because I am a retired fellow, has lot of experience, so मेरे पास जुगाली करने के अलावा कुछ है नहीं. उदाहरण बता सकता हूं मैं आपको. We used to talk to the telecom operators. So they'll say कि भाई आप ये बताइए कि you have an ARPU होता है average revenue per user per month. आपका ARPU 100 रुपया है. And how your telecom fellows are able to survive? एयरटेल सर्वाइव कर रहा है, जियो सर्वाइव कर रहा है, पहले वोडाफोन भी सर्वाइव कर रहा था, सब लोग सर्वाइव कर रहे हैं. हमारे यहाँ तो ARPU $150 है. एंड तब भी रोते रहते हैं लोग. तो हमने कहा भैया तेरी पॉपुलेशन कितनी है? बोले 10 मिलियन. हमने कहा हमारा 1.3 बिलियन हो गया, 1300 मिलियन हो गया. सो वी आर 130 टाइम्स. तो इफ यू मल्टीप्लाई 100 रुपीज विद 1.3 बिलियन and if you apply $150 with 10 million, which is larger? So हमारा तो खेल यही है. हमारा numbers is our, liability कहिए आप उसको या जो भी कहिए उसको, मतलब advantage भी हमारा number ही है. Players who are working lens cards of the world, who are making probably chashmas for, fellows like us who guess कि भाई चल 5,000 का है तो चलने दो, 5,000 का चलेगा, हमारे लिए कोई बहुत बड़ी चीज नहीं है, पेंशन से काम चल जाएगा उसमें. But this kind of this economic model is quite different. And here I think the institutions like Nudge, with the help of the government, with the help of, this public-private partnership, that's what I said, they can actually demonstrate. And I'm not saying they should do all charity. No. They can demonstrate that this is a model which is actually quite powerful model. Today, let's put it this way. आप किसी आदमी को चश्मा दीजिए और कहिए कि भैया तू जो काम कर रहा है उसमें तेरा 5 रुपया पर मंथ बढ़ेगा प्रोडक्टिविटी, तू मुझे 5 रुपए का EMI कर दे और मैं तेरा काम करूंगा. It is possible. Micro credits are possible today, and it's not a great thing. You can do all kinds of, you can design financial instruments which are very low value but large numbers and which can actually work like magic. So I think we can design, and I mean, probably some of us can sit down together, those who are in the government, those who are outside the government, those who are in the civil society sectors, etc., we can design something which can actually become a self-propelling stuff. It is possible. Believe me, there is money into even this venture. Only thing is we need to appreciate and realize it. We should not say कि एक चश्मा मैंने 10,000 का बेच दिया वो ठीक है. हमको 1,000 चश्मे 100 रुपए के बेचने हैं. Then then we will be able to get money even out of that. So I think that's how it should actually work.
Thank you, sir. Telecom is a good analogy. I also spent much of my professional life in telecom, and ARPU is one KPI I worried about a lot. And both in the US and India, and I used to wonder that the 2 rupees, how would 3GB will be viable? And now we have operators who have subscribers which are larger than countries, right? So
एक statistics आपको देना चाहता हूँ. Sorry for hogging the thing. In America, the 1 GB of data, how much is the cost of 1 GB of data? $4. $4.35 it used to be some time back. In India, what is the cost of 1 GB of data? Can you guess, friends? No? 7 rupees. 200 रुपए के प्लान में 28 दिन एक जीबी डेटा मिलता है. नहीं मिलता है. 200 को 28 से भाग दे दीजिए 7 रुपया. So you have 7 rupees, which is actually about 10 cents or maybe 9 cents versus $4. And all this is the magic of numbers.
thank you, sir. So, Amit sir, let me turn to you. And you are now working on this initiative, as you mentioned, and you are looking at some of these elements with which Ram sir talked about. So, would you like to elaborate what are some of the elements you are considering in the design of this scheme? What are the features you are looking at for scalability and cost effectiveness?
See, we need to understand how the whole ecosystem works. The first thing is, as was said that you have to have, if you are buying a reading glass or a spectacle or any kind of thing, you need an optometrist to actually first test your eyes, do this assessment, give you the correct, what will be plus, minus 0.51, 1.25 or whatever. And then someone makes those lens, and then it's put on a frame, and you have to go to the market and buy it. This model which we are talking of is absolutely different, where you don't need an optometrist. Because India, we have, I think so, probably a ratio of optometrists to the population would be probably one optometrist for lakhs of people. So you can't get those optometrists. So if that is one market failure or the challenge which is there. But can we, by just sheer 1 or 2 days of training, put someone and tell them that if someone is looking this far, this is correction level is 0.5, or if it's looking this much, it's 0.1, 1 or 1.5. Simple training can get you what a trained, qualified, professionally certified optometrist can get. So that's the first part of the ecosystem. Do the assessment, and that assessment can be really cheap. Second is, how does it work thereafter? One is just the sheer cost of manufacturing those glasses. As has been pointed out, it's roughly around 100 odd rupees. You can get 0.5, 1 or 1.5. In a simple frame, I can get a frame which may cost me probably 1 lakh, and so on and so forth. But a normal frame, if you buy, doesn't cost you less than 5,000 minus the lens. So that with the frame, the lens can cost you 100 rupees. So that's the second part of the ecosystem, the equipment itself, the testing, the equipment itself. The third is the most important thing. How do you reach out? How do you reach out? And as has been pointed out, the sheer numbers and the spread of the population. I have to reach out to across the country. We are a large country, areas, and going out and reaching out. So the bigger cost, and that's why when I said $4, the bigger cost is reaching out to the intended beneficiaries. And that, how do I converge? How do I leverage my existing setup? That's where the market failure, which was being talked about, because when the market goes, they will see all of this. and where market failures are there, and as welfare state and otherwise, the government steps in. So I can converge and leverage with my existing networks. There can be various models which can be done. It can be done through outsourced agency. It can be done through the existing health network which we have, the Anganwadi network as there. I can train my Anganwadi worker and provide them simple glasses in supply, which then they just, based on their training, whoever comes, they can provide that. So the reach and accessibility can be done by existing government setup, convergence, working government as a whole. So that's the third dimension to the whole thing. The testing, the equipment, and then the actual supply of the network which is required for it. And back of the envelope, we've done calculations. We looked at one of our work which we do in our ministry is with regard to older persons, elderly. And we did that calculation that if the elderly requires this kind of support, what would be the cost? So we looked at it that 3 million people, that means roughly 30 lakh, can be just provided by 100 crore. Actually less than 100 crore, with all the logistics, all the training, or the cost of the material, that this glasses is not the issue. How do you create, and as what Sir has said, how do you create the institutions to ensure that it gets delivered and it reaches the intended beneficiary in their village, in their small town, in wherever they are living? And that is the challenge. And as rightly pointed out, the opportunity cost, the impact it has, whether it's on the safety aspect, whether it's on the simple thing of how you are cooking, to how you are, if you are in a safety, if you are in a factory, and if you have the machine, if you get so many accidents, it's just because most of the time you don't realize it. It's just because you have it's a proportion, it's directly related to your age, and therefore all of those aspects can be done. So the cost benefit in productivity, in human lives, in dignity, in economic empowerment, all the right words which we can use can be fitted into this simple model. And then that's why I think so we are, as a department, are stepping in to take charge of this, working with other departments of the government on this aspect.
Thank you, sir. So, Amit sir brought up a very good point. So, in India, there's really severe paucity of optometrists. So, as he said that on average, we have about one optometrist for 1.8 lakh people, while as OECD average would be about one optometrist in 8 to 10,000 people. So, optometrists cannot solve this problem. There's one more enabling condition in our country, but which is not very well understood, is that eyeglasses are not medicalized. It is not a medical device as such. I'm living in Bangalore, or any big city. I can walk into any store, get a pair of glasses without any doctor involved, right? Irony though is that the person who is living in rural area, who doesn't have access to these stores and these optometrists, that person needs to go to a doctor, right? So Jaijit, let me turn to you. So what kind of regulatory clarity do you think is lacking, which is causing this problem, and what should be done about it, so that if we are clear about what are the rules and regulations, what are the safeguards? This is something developed countries have clearly done decades ago, but we are lagging behind, and there's different interpretation behind it.
The government has taken steps, right, to solve it, but there are aspects of the regulation, I don't want to go into the details of it, which does not provide the differentiation at the level of clarity that you're talking about, which is essentially that reading glasses clearly do not need an optometrist. It's not a medical device. So you don't need to have a prescription from an optometrist to be able to get the support from the government, right? So the schemes are there, but those schemes cannot get operationalized because of what Sir just mentioned. There aren't that many optometrists. So could we possibly provide training to the very large number of ASHA workers, as an example, and say that the prescription from an ASHA worker is good enough, But even that makes life complicated because, as what Sharma ji mentioned about Amma, the glasses have to be brought to her. She can't go and get the prescription and then go through a process of requesting the government to give her a glass. That's way too complicated, right? As it is, the lady can't see, and then we are saying you first go and get a prescription, then you apply, then you chase up your local panchayat or whoever. That's way too complex. And therefore, what Amit was mentioning, can the glasses come to her? And therefore, the tweaking in regulations is needed such that the reverse process starts. And if you're trying to solve the problem of 30% of this population, and as again Mr. Sharma mentioned, is that your glass and my glass are different. So it's not that we're going to fall on it and use it and leak it to the market. Why don't we push a large number of glasses of different powers to the rural areas where people really need it, and skip this part where a prescription from optometrist is needed, because any which ways it's not a medical device. Any which ways, as per the law of the land, it is not required. As long as you train an ASHA worker who gives you the power, or she gives the power, it should be good enough, and you go and pick it up. And then the market economics can start playing in the way Mr. Sharma just mentioned, which is the government then says, per glass that you provide, you get 10 rupees, 50 rupees, whatever that amount may be. But at least now you know where the market is. It's a very, very focused approach, and some of the regulatory hindrances are taken away. So absolutely right, Amit. There are regulatory hindrances, and those need to be papered out if we really want to have a saturation level solution of presbyopia in this country.
Thank you, Ravi. I have my eye on the clock as well. Let me check if there are any audience questions.
Amit, can I just say, if you look at it and the discussion and all, very clearly one issue is of the access. So, the access, which has been rightly pointed out, is one issue. The second is the affordability.
Yeah.
So I'm talking of A's, and you and I are Amit, but
Yeah.
so it's access, affordability. It's also the attitude. A lot of time we just don't want to put on glasses. It's a concept which is probably deep rooted कि भाई मेरी उम्र बढ़ जाएगी या मैं ज्यादा बुढ़ा लगूंगा क्योंकि मैंने चश्मे लगा रखे हैं. So that attitude and behavioral issue is also there. And fourth is the awareness कि actually my eyesight has deteriorated with age. I'm 45, I'm 50, and therefore the awareness that I need to have that. So if you address these 4 A's, the accessibility, the awareness, the attitude, and the affordability, you have the right model for addressing the country's challenge on a very, very simple, low-cost intervention.
Thank you. Thank you, sir. So let me, I have some questions which are touching some next set of questions also. So we have many competing priorities in the country, and there's only so much money available for different kind of welfare. So one question comes is that how do we assess return on investment, so to speak, right? And Ram sir, let me ask you this. It is intuitively clear from our discussion that there is a socio-economic inclusivity return on this simple investment, right? But at the end of the day, when budgetary allocations are done, we will have to see that what is the return from investment in priority A versus priority B, right? So what are the right ways to look at, what would be the benefits, and why investment on reading glasses or any other such initiative should be prioritized if we have to choose between multiple competing priorities?
No, I think you are very right that we have too many demands, and the resources are obviously constrained. But then I think in every sector or area there are low-hanging fruits, and which actually are no-brainers, as Jaijit said. No-brainers to say कि भाई इसमें 10 रुपया लगाएंगे तो मुझे 100 रुपए का फायदा होगा. So I think this is one such part. For example, I had proposed, this is another issue again coming back to diabetes. Now, diabetes, how much are we spending by way of treatment in Ayushman Bharat itself? How much is the bill hospital bill of Ayushman Bharat, suppose it is 100 crores. Now, if I can prevent the diabetes or control it on my beneficiary target group, which is pretty significant, which is about 60 crores people are actually enrolled and are getting insurance coverage in Ayushman Bharat. If I can do that, then then we can figure it out that this is actually a much better alternative. So it's not only a question of which sector you kind of intervene, it's also a question that in a given sector, what should be your nature of intervention. So whether in diabetes you want to have the hospitals treating the patients, or you want to have a preventive stuff whereby you don't allow it to degenerate beyond a point so as not to take hospitalization, is actually an alternative which should be weighed in. Suppose you are spending 100 rupees there, and if you can prevent this 100 rupees expenditure in 50 rupees investment, that probably will be a better part. So I think this is what we need to probably do it in every sector, and I'm sure the government is cognizant of these facts. One advice, Amit, I will give you. For example, logistics, as you rightly said, that it is very difficult, or it is actually a problem which is going to take place, which is going to become, when you have 100 crores or maybe 50 crore people you are distributing chashma, how do you do that? So my sense is that, if you use the sarkari machinery in doing that, I mean, I'm sorry, I may sound very counterintuitive because I have also been a sarkari fellow for a long time, 45 years of my life. If you do that, they probably will have not much incentive. And the kind of money they are getting, they will say, Acha, maan lijiye, if you give 5 rupees per chashma as an incentive, what is the point? I think they are the logistic fellows. The Amazons of the world, the Flipkarts of the world, all these fellows have created their bases up to village level. And they can always create, suppose 20 रुपया रखो एक चश्मे पे, और किसी प्रदेश में you can try it out. कि 20 रुपया हम कहेंगे कि भाई देंगे, और 10 करोड़ पीपल है, 200 करोड़ का ठेका हमने दे दिया आपको, भाई साहब आप दीजिए. नाउ यू मेक इट मैंडेटरी दैट आप उनका आधार ऑथेंटिकेशन करवाइए भाई साहब आदमी का, परिवार के एक आदमी को जो देंगे, यू गेट इट डिलीवरी के टाइम पे. एंड देयर आर मल्टीपल मेथड्स. ओटीपी है आजकल, जो अमेजोन वाले आते हैं तो ओटीपी करवाते हैं टू एंश्योर दैट द डिलीवरी हैज हैपेंड. So therefore, I will pay you money only when you deliver this chashma to that fellow. I can tell you, you can actually optimize this whole thing. I mean, that's my sense. Maybe I'm not wrong. Maybe I've been out of the thing for a long time now. But my sense is that this logistic problem, which is actually a hard problem, number one. Number two, getting the inputs from the, presbyopia measurements from each people, you can probably, put a technology solution where, again, somebody comes to a common service center, somebody is probably, you just pay him some money, 5 रुपया देंगे हम आपको इनका करके दीजिए, and you can have a non-reputable situation that this person has indeed carried out that presbyopia test and is now sending me the thing. So therefore, you can have a crowdsourcing of the data with very reliable data of the persons, their addresses, their other things, कि इनको चाहिए. Then you can say, all right, this is 6 months is only for crowdsourcing the data. I'll crowdsource the data. Maybe when I get a critical mass of, let's say, 50 crore, then I'll start production. Maybe, it's not such a problem where I have to provide glasses the next day. Maybe I can provide after 2-3 months. Because अब इतने वर्षों तक बिना ग्लास के रह लिए तो 2 महीना और रह लो यार. So what you can do, you can have a critical mass collected, manufacture them, and then distribute it. That's, very simplistic and very trivial, and I'm sorry, very naive way of explaining it. I'm not sure whether that's a correct way, but I just thought my junior colleague, I'll give you this advice. Try to do it in some pilot area.
Thanks, sir. Absolutely right. That's why I said there are 2 ways. One is the outsourced way, and the other is using the existing system. That is the biggest challenge we are exploring right now, that how do I deliver it. Production is not a challenge. We've talked to people. Production is not a challenge. Right. The numbers, N numbers can be produced once you have that. The whole thing is how do you deliver, and that's where the actual larger cost is, not on the actual product itself. And the right way to do it is something we'll probably have to learn and do it. But yeah, use of technology, use of all of that. And you've given very valuable pointers, which we'll take into consideration.
Amit, sorry again. See, मेरा सबसे बड़ा mistake आधार में जो मैंने किया, and I don't know whether somebody from postal services here or not. हम लोगों ने, our cost is basically, आधार में cost थी 40 रुपया per Aadhaar to the state government. In fact, it was 50 in the beginning, then we reduced it to 40 because we realized that the states are making too much of money. 40 रुपया. 26 रुपया was the cost of delivery through a India Post. You know that is speed post. It takes 26 रुपया. 26 रुपया was 4 रुपया था इसका printing का cost and 22 रुपया था delivery cost. And that 26 रुपया multiplied by 100 crore is how much? 2,600 crores we paid to India Post. And what was the result? There were bags of Aadhaar cards which were lying in the nalas and nadis and everybody, because the Dakia fellow, I mean, we are greatly talking great things about Dakia, which is a memory wise ki matlab Dakia, Dak laya, ye sab kiya. Lekin the actual situation was they were throwing away because there was no accountability. After all, we did it to ensure that the person, the address which the person had dictated at the time of enrollment, actually he does live on that thing, because that is why speed post was done. Speed post is one of the instrument where you have the daskhat of the fellow, but nothing was done. And that was one of my wastage of 26. Now out of 100 rupees or 70 rupees, 26, 1/3 was going to this delivery cost. You are right. Delivery cost is the maximum cost which we suffered. And actually we realized that it was a bad idea to give it to somebody who is not responsible and accountable, and which is sarkari to sarkari machinery. I can't do a muqaddama on the India Post, and therefore it is all, theek hai bhai, chaliye, घर की बात है. That's all.
Thank you, sir. Yeah.
बहुत खराब अनुभव. I think that's what we're trying to write.
Sir, Amit, we have 4 minutes left. So Ram sir have very eloquently talked about the challenges and how we should structure it. Now, this scheme you're working on, sir, this once it's rolled out, what would success look like? How would you measure success, whether it has achieved its goal or not?
See, success, there are different ways to look at success. Whether an accident has happened or not, whether the plucking of the top 2 leaves, if you are in tree plantation, is done in a much faster way, so that the collection is much in a shorter time. Or whether it's when I'm doing an embroidery work, thread and needle, how fast that manual work has happened. So across sectors, the measurable, I think so, is if the beneficiaries or the intended beneficiaries have got an empowerment, a dignity and an empowerment. And I think so that's the success. You can't quantify it in the just the key. This person has got this much and this person has got this much. If it has led to productivity gains, which in economics terms would lead to a greater money flowing into them, or if they can do it, even simple thing like cooking or crop cutting. So I think so the measure of the success is probably the smile on the people's face, and living with some pride and with dignity. That would be the success.
Thank you, sir. Yeah, sure.
Because we were talking about the return on investment. We did the calculation for number of states, where I'll take up Madhya Pradesh, that once they get the glasses, their additional income goes up to 7,000 rupees per month, out of which at least 3,000 rupees they will spend on goods which are GST-able goods, which means that monthly, even if you look at today's 5%, earlier it was 18% when we did the calculation, they will have 15 rupees per month going back to the state government, which means that in 10 months' time, there's a hard return on the investment. Yeah. You spend 100 rupees in the glasses, in 10 months, you get 150 rupees back. And so that's one way of looking at it. I'm not a big votary of that because clearly, I mean, coming back to the great example of Amma, she will not be part of this calculation. But everybody has the right to dignity, as you said, sir, and the right to live a fuller life. But there is a return on their investment, a very hard return that's happened.
So what you're saying is that, of course, in the monetary terms also, we can very, very easily make a case that whatever investment is made, it will come back to the government very easily. On top of it, there are socio-economic returns, which we talked about. We are almost out of time. Thank you very much for a great discussion. So clearly, it is a problem which we can solve in a few years. There are systems in place. We have esteemed panelists here who have done and solved even larger problems and more complicated problems in more economical ways. Innovations are going on in terms of distribution. Manufacturing does not seem to be a challenge per se, so long as there's a demand predictability. So hopefully in a few years and with your leadership, sir, we'll see something rolled out which can be replicated across the country. Thank you very much.
Thank you so much. I think चश्मे तो सभी को लगेंगे. After 40 you will get it, except for I think Amit Yadav ji यहाँ पे who has miraculously escaped the presbyopia gene. But मेरे भी है कहीं तो. So the average lifetime of Indians is also increasing, which means that the average duration that we will wear eyeglasses is also increasing. Eyeglasses can be a life-changing decision for the vulnerable. It can increase the quality of life and productive age by 10 to 15 years. Amma ko chashme milne chahiye. So with that, would like to close this session, but would request our volunteers to just felicitate our panel members. Thank you so much for the really engaging, very interesting panel. Thank you.